In the heart of the city, we find Dr. Campbell, a renowned cardiologist, Elizabeth, an eager medical student, and Michael, a patient experiencing heart palpitations. Renowned for his expertise in cardiology, Dr. Campbell is a beacon of hope for many. Elizabeth, with her insatiable thirst for knowledge, is eager to learn from the best. Then there's Michael, whose recent brushes with heart palpitations have led him to seek help. As they sit in the doctor's office, a discussion about heart palpitations begins. "Dr. Campbell, I've been feeling my heart racing recently," says Michael, initiating the conversation. Dr. Campbell, with a reassuring nod, replies, "What you're experiencing, Michael, are what we call palpitations. It's quite a common sensation, actually. It's when you become aware of your heart beating in your chest. Think of it this way," Dr. Campbell continues. "Imagine your heart is like a drummer in a band, keeping a steady rhythm. Most of the time, you're not even aware of the drummer doing his job. But every now and then, the drummer may decide to throw in a surprise solo and suddenly, you're all ears. That's what palpitations are like. It's your heart's impromptu drum solo." Elizabeth, the medical student, chimes in. "So, it's not just a feeling of a faster heartbeat, right?" "Absolutely, Elizabeth," Dr. Campbell responds. "Palpitations can be experienced as a fluttering sensation, a skipped beat, or even an extra beat. It's not always about speed, it's more about the rhythm being off. It's like our drummer hitting the cymbals when you expect a snare or playing a jazzy rhythm in a rock song." Dr. Campbell then adds, "It's important to note though that palpitations themselves are just a symptom, not a disease. They're your body's way of telling you that something might be off, like a warning light on your car's dashboard. It could be due to stress, caffeine, certain medications, or even underlying medical conditions, but it's not always cause for alarm." "So it's like my heart is running a marathon without my permission?" asks Michael. Dr. Campbell chuckles and nods. "Exactly, Michael. It's like your heart decided to go on a sprint, leaving you wondering what the rush is all about." "But what could be causing this?" Elizabeth asks, ever curious. Dr. Campbell, with a thoughtful expression, begins to explain the various cardiac causes of palpitations. "Firstly, let's talk about arrhythmias," he says. "These are abnormal heart rhythms, which can result from changes in the heart's electrical system. There are several types of arrhythmias such as premature atrial contractions, PAC, premature ventricular contractions, PVC, supraventricular tachycardia, SVT, and ventricular tachycardia, VT. Each of these can cause the heart to beat too fast, too slow, or irregularly, leading to sensations of palpitations." He then moves on to the next cause, valvular heart disease. This involves damage to or a defect in one of the four heart valves: the mitral, aortic, tricuspid, or pulmonary, Dr. Campbell explains. The valves ensure blood flows in the right direction around the heart. If they're not working properly, the heart has to work harder, which can cause palpitations. The third cardiac cause Dr. Campbell discusses is hypertrophic cardiomyopathy, or HCM. This is a condition where the heart muscle becomes thickened, making it harder for the heart to pump blood, he says. HCM can lead to a variety of symptoms, including palpitations, shortness of breath, and chest pain. Throughout his explanation, Dr. Campbell uses simple language and relatable analogies. He makes sure to check in with both Elizabeth and Michael, ensuring they understand each point before moving on to the next. As he wraps up his explanation of the cardiac causes of palpitations, Elizabeth synthesizes the information. "So, palpitations can be a sign of underlying heart conditions," she concludes. "That's correct," confirms Dr. Campbell, offering a nod of approval. "Remember, our hearts are like the engines that drive us. When they're not running smoothly, it's important to find out why. Palpitations are the heart's way of letting us know that something might not be quite right. But don't worry, we're here to help you understand and manage these symptoms effectively." Scene script. "Are there other causes aside from heart conditions?" Michael inquires. "Absolutely, Michael," begins Dr. Campbell. "Let's start with the endocrine system. Your endocrine system is responsible for hormone production and regulation, and sometimes, it can go into overdrive. Conditions such as thyrotoxicosis, where the thyroid gland produces excessive thyroid hormone, pheochromocytoma, a rare tumor that releases too much adrenaline, or even simple hypoglycemia, low blood sugar, can all cause palpitations." Michael nods, taking in the information. Dr. Campbell continues, "Systemic causes can also be at play. For instance, a high fever or anemia, which is a lack of red blood cells, can both lead to palpitations. Then we have certain drugs," Dr. Campbell proceeds. "Stimulants like caffeine or nicotine and anticholinergics, which are used to treat a variety of conditions, from gastrointestinal disorders to respiratory issues, can all cause your heart to palpitate. And let's not forget about the mind's role in all of this, he adds. Psychiatric conditions, particularly panic attacks, can often manifest as palpitations. It's your body's way of signaling that it's under stress. Michael looks thoughtful, trying to piece together the information. So, it's not just about the heart, he ventures. Palpitations could be a symptom of other conditions. Indeed, Michael, Dr. Campbell affirms. Palpitations are like your body's alarm system. They alert you to the fact that something might be off. It could be your heart, yes, but it could also be your hormones, your blood cells, the medication you're taking, or even your mental state. That's why it's so crucial to get these symptoms checked out. Understanding the cause is the first step towards effective treatment. So, what should someone like me do, Dr. Campbell? Asks Michael, looking for guidance. Dr. Campbell leans back, taking a moment to gather his thoughts. Michael, your question is one that many others also have. The first and most crucial step is to seek professional consultation. The world of medicine is vast and complex, and while the internet can provide a wealth of information, it cannot replace the expertise of a healthcare provider. He continues, healthcare professionals are trained to look at the bigger picture. They take into account not just the symptoms, but also your medical history, lifestyle, and overall health. This holistic approach allows them to make an accurate diagnosis and develop an effective treatment plan. Turning to Elizabeth, Dr. Campbell emphasizes, as future medical professionals, it's vital to remember that each case is individual. What works for one patient may not work for another because of the unique combination of factors at play. He assures Michael, you're not alone in this journey. Your healthcare provider will guide you, answering any questions you have and addressing your concerns. They'll walk you through the process, ensuring you understand both the problem and the solution. Pausing for a moment, he adds, the path to health is a collaborative one. You, as a patient, play a crucial role, but so does your healthcare provider. It's a partnership. Remember, each person is unique and so is their health. Always consult with a professional, Dr. Campbell advises. This has been quite enlightening, Dr. Campbell, Elizabeth states, grateful for the knowledge. Indeed, it has been a journey of discovery, a dive into the complex world of heart palpitations. We have explored the myriad causes of this condition, from cardiac arrhythmias like PAC, PVC, SVT, and VT, to endocrine issues such as thyrotoxicosis, pheochromocytoma, and hypoglycemia. We have learned that systemic issues like fever and anemia can also result in palpitations, as well as certain drugs, particularly stimulants and anticholinergics. Not to forget, panic attacks, which fall under the psychiatric category, can also manifest as palpitations. But it's not just about understanding the causes, is it? It's about understanding that these palpitations are not merely symptoms, but signposts pointing to underlying health issues. They are the body's way of communicating that something isn't quite right, a cry for help that should not be ignored. Dr. Campbell, with his years of experience and expertise, stresses on this point repeatedly. Heart palpitations can be quite alarming, but it's crucial to remember that they are often benign. However, persistent or frequent episodes should not be dismissed. It's far better to seek medical consultation and have it be nothing than to ignore it and have it be something. The journey of understanding heart palpitations is also about realizing the importance of professional consultation. Each person's case is unique, and therefore, requires a tailored approach. Self-diagnosing or self-medicating can lead to unnecessary anxiety or even harm. Dr. Campbell's message is clear: always consult with a healthcare professional. They have the knowledge and the tools to make an accurate diagnosis and to guide you through the appropriate treatment. As we wrap up this enlightening discourse, let's remember the cardinal rule of health. Knowledge is power, but only when wielded by the right hands. Knowledge is the key to understanding, but remember, it's a healthcare professional who holds the lock, concludes Dr. Campbell.